There is no doubt that AI is going to change the world. But it doesn't mean that the world has to change overnight. We're in control of when and how we deploy this technology. And I'm about to sit down with someone who has deployed AI in a very, very specific way, in a very practical way, to the benefit of both their patients and their clinicians. Hello and welcome to Healthcare IT Today, where we explore the latest trends and interesting stories from the world of health IT. I'm Colin Hung, and I'm about to sit down with Dr. Seth Eaton. He's with MedPeds, and they have deployed eClinicalWorks' AI assistant to help them manage their inbound fax queue. This is allowing them to handle the high volume of electronic documents that they receive in their practice. I can't wait to see what he has to say. Let's get to it. Dr. Eden, welcome to the program.
Well, great to be here.
I'm excited because we don't get a chance to talk to a lot of folks who are using AI to interpret and help with inbound faxes. But before we get there, can you help me give our audience just a little bit of information about yourself and your organization?
Sure. So my name is Dr. Seth Eaton, and I'm internal medicine pediatrics. And our practice has been electronic for about 20 years with eClinicalWorks. And we have 10 providers at a single site in Maryland. And we just focus on primary care.
Now, I want to pick up on something you just said there. You glossed right over it. 20 years you've been on eClinicalWorks. You adopted electronic medical records before any of the incentive programs. That's super pioneering of you.
Well, actually, when we adopted the electronic records, we had no idea what we were doing. We literally scanned all our records that were 2 years old and essentially removed all the paper charts from the office, and suddenly everyone had no choice but to use electronic records because there were no paper charts in the office. And that was an era where people just were not doing this. But it certainly was a cultural shift.
I like that. You went cold turkey and it worked. You're here to tell the tale, so clearly it worked.
Well, we had our long-term nurse was working, and she said, "Well, I need to write this down. Where's the pen and paper?" And we just said, "Well, the pen and paper are no longer around. You have to go on the computer to write it." But it was a transformation that has played out over time.
That is fantastic. That is fantastic. We don't get a chance to talk with a lot of people who implemented an EHR well before the incentive program. So kudos to you for doing that. But I wanted to ask you a little bit more about what you spoke about on stage here, and that was around using AI to help with the inbound faxes and that fax inbox of yours. So tell me a little bit more about how you are using AI for that reason.
So AI basically reads incoming documents, identifies the patient, and is able to identify within our system which patient it applies to, and it then attaches that document to that patient record. We then have to still take that record and attach it to a specific portion of the medical record. And for that, we use an outside service that gets into our charts and does that last piece.
Mm-hmm.
We've been beta with this since this last fall, and beginning in December, we went live, and virtually all the incoming documents are correctly attached. I don't know the percentage no longer that have to be done manually, but it's a fairly seamless process at this point.
So it sounds like, has this really saved you a lot of time in terms of not having to go through that fax queue and read each one and figure out which patient it has to go to? You can now just go right into the patient's record and figure out where within the record where it's supposed to be attached to?
I don't have the real intrinsic details on how much it saves per visit, but we pay an outside service to do the attachment of the documents. So for each click they have, there's a charge for that click. So if we have one fewer click because the consultation's now attached to the patient chart, they have one fewer click they charge us for. So it's the estimate is about 10% of our cost of document management has been reduced.
Wow, that's a significant savings.
Well, it is, but the key is with EHRs having more wider implementation and EHRs having more successful adoption of automatic transmission of records to another doctor's office, we're getting more and more documents coming into our sort of library of what the patient's records are, and we have an increasing number of costs associated with sort of maintaining that library.
Gotcha. So the volume is increasing because everyone has gone electronic, and it's so easy now to send that kind of a documentation. Now with this AI on the inbound fax queue or the inbound queue, it's able to do a lot more now.
Correct.
To handle that volume. That is great. And you know, how have your fellow physicians have reacted to having this kind of technology? Are they happy with it? Or are they?
No one really thinks anything about it. This is not a physician level issue that gets addressed. Even on the management side, it's really just in the background. And the key issue is we want to see the documents in a timely fashion attached to the chart. And to the extent that this may facilitate the timeliness of the attachment, people are happy, but we only hear about it when they're not attached to the charts.
I'm sure you always hear about the exceptions, I'm sure. Is there anything that, as you look at what ECW is doing, that's got you excited in terms of other technologies that might have?
Well, they clearly are looking to upgrade the sophistication of how the documents are attached. So, for example, we have quality measures that look at, are we looking at having an ophthalmologist see a diabetic, and way we track that is based on a structured field that identifies that they've had an eye exam in the last 12 months. And what this platform is going to do is take not only that the name is going to be attached to the chart, but if it's an ophthalmologist, that will be attached to the structured field of the ophthalmology exam so that we can more easily document which patients need to be reached out to make sure they get their retinal exam done as a diabetic. So it's going to improve care on the next level, next iteration of the technology.
Gotcha. So you're really impacting the workflow and not just some of the back end stuff, because now it's able to turn that field on for you. Interesting. Doctor, you shared a lot of great information with us today. Where can people go, or what website can people go to learn more about your practice?
Medpeds.net.
Awesome. Well, thank you so much for being on our program today. Really appreciate it.
Okay. Thank you. Wonderful to be here.
Hey, I want to thank Dr. Eaton for coming on camera with me and giving us that behind the scenes look at how they have deployed eClinicalWorks AI tools for managing that fax inbox. It is definitely something, as he mentioned, that it's saving them money, but more importantly, just helping them handle the increased volume of electronic documents that are coming into their practice. And hey, if you enjoyed this interview as much as I did, please like and subscribe. Also, head on over to healthcareittoday.com, where you can find more great content like this. I'm Colin Hung. Thanks for being here, and I'll catch you on the next video.